So on to something that is quite significant and very serious in this country as we approach 16 days of activism against women and child abuse, as well as World AIDS Day around the corner. Women activists who just happen to be doctors in South Africa have decided to come together and form an association that puts them in the forefront of academic and social solutions in this field. Well, some of the founders of the Medical Women Association of South Africa, MWASA, are here with us in studio. We have Dr. Malebo Maponyane. And Dr. Malebo is a general practitioner and, as I mentioned, one of the founders of this organization. She's joined by Dr. Grace Makgoka, and Dr. Grace is an HIV/AIDS specialist working with the Foundation for Professional Development. Ladies, a very good morning to you both. Thank you so much for joining us.
Good morning. Thank you.
MWASA is the acronym correct? Is that how you pronounce
MWASA,
it? It's in inception stages, launching this weekend, Saturday and Sunday. Talk to us about why you felt the need to put together a group of female doctors and tackle such issues.
Okay. As you know that in South Africa, if you look at the minority women doctors, in terms of the statistics, we initially didn't really have like sort of a presence in terms of medical doctors, in the medical schools. But as you can see, the statistics, we are, increasingly going up in terms of the medical schools having the medical women. But we saw the need because the National Professional Organization, we sort of want to represent and make sure that women are targeted in terms of, your health policies, health systems, and make sure that the practice of medicine is actually, sort of sound enough to support the medical women in South Africa.
What do you plan to do as an organization?
Well, we have several objectives that we want to achieve, and one of them really is to make MWASA a platform for the members to share information with other stakeholders in the country in order to, shape policy in health policy and to shape the health systems in the country. But we also want to advance personal and professional development of the members in order to improve on capacity within the countries on medical care. We're also looking at affiliating, partnering, and working with other organizations with similar objectives and visions nationally and internationally. And also to mentor young and up-and-coming medical doctors, female medical doctors, in order to improve capacity in the country, but also to make sure that the sustainability of doctors within our healthcare system.
Doctor, I was actually just about to ask you about your developmental mandate to make sure that we groom our young girls to know that they can become doctors, and especially those who are already at university stages. We get a degree and you're satisfied and you go. We never pursue your master's and your doctorate. So how are you going to go and stimulate such thinking among our young females?
Well, we want to make sure that they know that there is a broad scope for them of work for them to do within the country, within the health system. Mainly what we've picked up is that women have for a long time, historically, women were not part of decision makers in health policies and in serious and high profile specialities within the medical fraternity. And we want to make sure that women have that opportunity and they are aware that they can influence the outcome of their health policies within the country. So we're going to be looking at mentoring them and making sure that they have all the necessary information in order for them to capacitate themselves to those positions.
Speaking about policies, Dr. Grace, talk to me about some of the partnerships that you're planning to form with various other stakeholders, perhaps government, when it comes to the issue of legislation.
Yeah, definitely. If we actually look back in terms of the background, the former Deputy Minister of Health, which is Dr. Makgoka, when this association was really initially formed, she actually came forward because the need was coming from other African countries, your Medical Women International Associations. But partnerships, government definitely is one of them. And we're going to be affiliated again with the South African Medical Association, which is SAMA, and of course other African international affiliators out there. So we actually definitely are going to be affiliated with different associations, which is quite very important. And like I said, SAMA is one of them.
In my intro, I alluded to the fact that we are approaching 16 days of activism against the abuse of women and children. We are approaching World AIDS Day. How do you envisage the contribution of MWASA to social issues and social ills that we face in South Africa?
Social challenges is one of the issues that is actually one of the objectives, like my colleague said, Dr. Malebo. We obviously have to make sure that these are the issues that are, looked at when it comes to, the 16 days. Just to let you know that when we're going to be launching the summit on 22nd and 23rd, the last day, which is the 23rd, we'll be talking about the Big Five. And one of the topics that will be discussed is violence for women or in women and children. So it will be the issues that will be discussed in that platform. And people like Dr. Carol Ben will be joining us to discuss other different topics like your breast cancer, cervical cancer. So definitely violence against women and children will be one of the important topics discussed there. And
just to add on to that, we're looking at a bigger picture. Aside from what we want to do as in improving the capacity of females within the profession, we're going to be looking at how do we improve the lives of women in the communities so that they are able to access the necessary healthcare system, and as well as improving the girls and making sure that they're getting educated and reaching their goals. So we're going to be looking at implementing projects countrywide where the communities that needs the assistance are going to be looked at and assisted.
From what I gather, this will be a support group for women in the medical field. It will be developmental in its approach and making sure that you groom youngsters and increase their capacity to participate in the medical field. But I want to know how you're going to measure success. How do you know when you've reached your objectives?
Well, I guess we'll be measuring success by seeing the number of women medical doctors in the health system improving their capacity, but also reaching the decision-making level within the country in order to improve policy. But one thing that has been noted globally was that the number of women getting into the health profession are increasing, but we still don't see enough women sitting in those positions that make the final decisions, in policy and all that. And we would like to make sure that we get those. Hopefully we would be having women who in specialities that have been mainly men-dominated taking over and making themselves seen.
We wish you all the best. I think this is absolutely necessary. As you said, other countries are already leading on the African continent. We were lagging behind a little bit, but now that women have come together in this particular sector, we do wish you everything of the best. And we hope to interview you perhaps in a year or two's time to check on how things have been coming along. Thank you so very much for joining us. Doctors Malebo Maponyane and Dr. Grace Makgoka as well, just speaking to us about the launch of MWASA, Medical Women Association of South Africa. Quick ad break. Morning Live continues after this.